In this video, we're going to start the path of blood. I like to start path of blood with the superior inferior vena cava, superior and inferior vena cava. It's just a nice place to start for the heart because it's the first structure of the heart that gets blood to the heart. So once we get back from delivering oxygen to the rest of the body, we're going to come through the either superior or inferior vena cava or coronary sinus. Then we're going to dump blood into the right atrium. Again, atria are these dome-like structures that sit on top of the ventricles, which are your V-like structures. So from the right atrium, we go into the right ventricle through this valve. And so this is the right atrioventricular valve or the right tricuspid valve. You cannot use right AV valve on your test because I need to make sure you know what AV stands for. So, but a lot in clinic people will say right or left AV valve for short, but that's because most clinicians know what that means. But you need to make sure on your test that you put atrioventricular or you put tricuspid valve. Now on this side we have the right atrium. We go through the right atrioventricular or tricuspid valve, and then we are going to go into the right ventricle. Now here we hit our first semilunar valve. If we are going through a semilunar valve, we are leaving the heart. So just to note, AV valves, we're staying within the heart. We're going from atria to ventricle, but then semilunar valves, they're named for their semilunar appearance, and that means we are going to be leaving the heart. So we go through the pulmonary semilunar valve. Pulmonary means lung, and so this is the semilunar valve that's going to leave the heart and go out to the lungs. And so we go through the pulmonary semilunar valve, and then we're going to go up the pulmonary trunk. The pulmonary trunk is going to branch into two arteries. Remember, even though arteries are red and veins are blue, for the most part, there are two exceptions to the rule. The first exception being the pulmonary arteries. We are taking blood away from the heart, but we are going to the lungs where we're going to get oxygen, meaning these arteries are going to be blue. So pulmonary artery, and then the other pulmonary artery is back here. Pulmonary artery. And then we go out to the lungs. By the way, the pulmonary trunk is the first structure that starts the pulmonary circuit. And then we come back to the heart, and if we're coming back to the heart, we are using pulmonary veins. So these are going to be the other exception to the rule because we're bringing oxygenated blood from the lungs. We're going to be bringing it back to the heart via the pulmonary veins. There are 4 of them. 2 on each side, and you can see the other 2 over there, or we can see them on this side as well. Those are the pulmonary veins. They will dump blood into the left atrium and then go from the left atrium to the left AV valve, the atrioventricular valve, which is also called the bicuspid valve or the mitral valve. You may use the left atrioventricular valve or bicuspid or mitral. All 3 of those are acceptable. Now, the mnemonic I use to make sure I remember the 2 valves, the tricuspid and bicuspid valves, anytime you try something, you want to try it, or anytime you buy something, you want to try it before you buy it. So try always comes before buy. It's one of my favorite mnemonics. It's just a really funny one, and it absolutely makes perfect sense. So once we go from the left atrium to the left ventricle through the left atrioventricular valve, we're going to go through yet another semilunar valve. And so once I move this structure out of the way, you can see it back here. This is the aortic semilunar valve. And so the aortic semilunar valve is going to go connect the left ventricle to the aorta, and that's where it's going to leave the body. Now, once the blood hits the aorta, we are starting the systemic circuit. So the pulmonary circuit has ended, and we are now starting the systemic circuit. The aorta is divided into 4 sections. You can only see 3 on this particular model, and then there's 3 arteries that branch off of it, but we'll learn those next week when we start blood vessels. So the ascending aorta is the first part because we are ascending, we are moving upward, but then we hit this part of the aorta we call the aortic arch, and that's due to its arch-like structure. On the back here we have the descending aorta, and those are the 3 parts of the aorta you can see on this model. But then the abdominal aorta is after it passes through the diaphragm the descending aorta becomes the abdominal aorta. So just note that in your notes somewhere, and then when we cover the Flatman model, we'll talk about that again. So I'm going to cover path of blood really quickly so you have a nice little review video for the end of this, and then again the accessory structures and blood vessels will be covered in another video. So if you haven't seen those yet, I highly recommend checking those out. So the blood is going to start coming through the inferior and superior vena cava, where it's going to dump blood into the right atrium. Blood will pass through the right atrioventricular or tricuspid valve into the right ventricle. From the right ventricle, we will go through the pulmonary semilunar valve through the pulmonary trunk. Pulmonary trunk out to the lungs via the pulmonary arteries. So pulmonary trunk, pulmonary arteries to the lungs, and then come back through the pulmonary veins, pulmonary veins, pulmonary veins. Note that there's only 4 of them. These 2 are the same ones that I pointed to out there. From the left atrium, from the pulmonary veins, we'll go to the left atrium, and then we will pass through the left atrioventricular valve, bicuspid valve, or mitral valve, and pass into the left ventricle, the aortic semilunar valve, ascending aorta, aortic arch, descending aorta. Blood will circulate through the body where it will then come into eventually the superior and inferior vena cava.